Hi everybody, this video of mine is about sun allergy or photosensitivity, which is a very common problem. Sun allergy is a term often used to describe a number of conditions in which an itchy red rash occurs on skin that has been exposed to sunlight. The most common form of sun allergy is polymorphic light eruption, also known as sun poisoning. Some people have a hereditary type of sun allergy, others develop signs and symptoms only when triggered by another factor, such as a medication or skin exposure to plants such as wild parsnip or limes. Mild cases of sun allergy may clear up without treatment. More severe cases may be treated with steroid creams or pills. People who have a severe sun allergy may need to take preventive measures and wear sun protective clothing. Now let me tell you the symptoms. The appearance of skin affected by sun allergy can vary wildly depending on what's causing the problems. Signs and symptoms may include redness, itching or pain, tiny bumps that may merge into raised patches, scaling, crusting or bleeding, blisters or hives. Signs and symptoms usually occur only on skin that has been exposed to the sun and typically develop within minutes to hours after sun exposures. See a doctor if you have unusual bothersome skin reactions after exposure to sunlight. For severe or persistent symptoms, you may need to see a doctor who specializes in diagnosing and treating skin disorders. Now let me tell you the causes. Certain medications, chemicals and medical conditions can make the skin more sensitive to the sun. It is not clear why some people have a sun allergy and others don't. Inherited traits may play a role. Now let me tell you the risk factors. Risk factors for having an allergic reaction to sunlight include race. Anyone can have a sun allergy, but certain sun allergies are more common in people with lighter skin. Exposure to certain substances. Some skin allergy problems are triggered when your skin is exposed to a substance and then to sunlight. Common substances responsible for this type of reaction include fragrances, and disinfectants, and even some chemicals used in sunscreens. Taking certain medications. A number of medications can make the skin sunburn more quickly, including tetracycline antibiotics, sulfur-based drugs, and pain relievers such as ketoprofen. Having another skin condition. Having dermatitis increases your risk of having a sun allergy. Having blood relatives with a sun allergy. You are more likely to have a sun allergy if you have a sibling or parent with a sun allergy. Now let me tell you some of the preventive measures. If you have a sun allergy or an increased sensitivity to the sun, you can help prevent a reaction by taking steps which I am going to tell you now. First of all, you should avoid the sun during peak hours. Try to stay out of the sun between 10 a.m. and 4 p.m. Avoid sudden exposure to lots of sunlight. Many people have sun allergy symptoms when they are exposed to more sunlight in the spring or summer. Gradually increase the amount of time you spend outdoors so that your skin cells have time to adapt to sunlight. Wear sunglasses and protective clothing. Long sleeve shirts and wide brimmed hats can help protect your skin from sun exposure. Avoid fabrics that are thin or have a loose weave. Ultraviolet rays can pass through them. Use sunscreen. Use a broad spectrum sunscreen with an SPF of at least 30. Apply sunscreen generously and reapply every 2 hours or more often if you are swimming or perspiring. You should also avoid known triggers. If you know that a certain substance causes your skin reaction, such as a medication or contact with wild parsnip or limes, you should avoid that trigger. Now coming to the diagnosis of sun allergy. In many cases, when patients come to us, we can diagnose sun allergy simply by looking at the skin. But if the diagnosis is not clear-cut, you may need tests to help identify what's going on. These tests may include ultraviolet light testing. This is also called photo testing. This exam is used to see how your skin reacts to different wavelengths of ultraviolet light from a special type of lamp. Determining which particular kind of UV light causes a reaction can help pinpoint which sun allergy you have. Second test is photo patch testing. This test shows whether your sun allergy is caused by a sensitizing substance applied to your skin before you go into the sun. In the test, identical patches of common sun allergy triggers are applied directly to your skin, typically on your back. A day later, one of the area receives a major dose of ultraviolet rays from a sun lamp. If a reaction occurs only on the light exposed area, it is likely linked to the substance being tested. Blood test and skin samples. These tests usually are not needed. However, your doctor may order one of these tests if he or she suspects your symptoms might be caused by an underlying condition such as lupus instead of sun allergy. With these tests, a blood sample or a skin sample, which is biopsy, is taken for further examination in a laboratory. Now coming to the treatment of sun allergy. The treatment depends on the type of sun allergy you have. For mild cases, simply avoiding the sun for a few days may be enough to resolve the signs and symptoms. Coming to the medications. Creams containing corticosteroids are available over the counter and in stronger prescription forms. For a severe allergic skin reaction, your doctor may prescribe a short course of corticosteroid pills such as prednisolone. The malaria medication hydroxychloroquine that comes with the name of Plaquenil may ease the symptoms of some types of sun allergies. There is another form of treatment, that is phototherapy. If you have a severe sun allergy, your doctor might suggest gradually getting your skin used to sunlight each spring. In phototherapy, a special lamp is used to shine ultraviolet light on areas of your body that are often exposed to the sun. It is generally done a few times a week over several weeks. Now, there are some lifestyle and home remedies which you can adopt to avoid sun allergy. There are steps which may help you to relieve sun allergy symptoms. These steps are avoiding sun exposure. Most sun allergy symptoms improve in less than a day or two if you keep the affected skin out of the sun. You should stop using medication that make you sensitive to light. If you are taking medication for other conditions, talk with your doctor about whether you can stop taking them if they are making your skin more sensitive to the sun. I just told you that there are some medications like tetracycline, antibiotics, which sensitize your skin to more sun allergy. So you should first consult to the doctor that can you stop the medicine or not, because if the medicine are necessary for some other condition which you are that's why you are taking medicine, so your doctor will advise you about that. Do not stop these medicine on your own without asking the doctor. Then you can also apply some skin moisturizers. Moisturizing skin lotions can help relieve irritation caused by dry and scaly skin. Also, there are some soothing skin remedies available. You can try applying calamine lotion or a lotion with aloe vera to ease your symptoms. This video was requested by one of my viewer, and he is suffering from sun allergy, so I am making this video especially for him. And you can also benefit from this video. If you are suffering from sun allergy or if you have any other illness, please write about your illness in the comment section of this video, and I'll try to reply to your comment as soon as possible. And if I get a time, then I'll try to make a video about that illness, because my channel Hubit BB is for helping humanity all over the world, and almost on daily basis I post videos on this channel in two languages, in Urdu and English languages, and most of my videos are of those illnesses which I have dealt with already, and I share my clinical experience along with my medical knowledge with everybody by making these videos. So if you have not subscribed to my channel, please subscribe it now and click the bell icon so that all upcoming videos are delivered to your inbox straight away from YouTube. And if you think that my videos provide some sort of benefit, even if it is 5-10% benefit or even if it is little benefit, then please like the videos so that I get encouragement once you like the videos. and do not forget to share my videos with your friends and family. Also, if possible, share my videos through social media such as Twitter or Facebook, so that more people can get benefit from my videos, because this channel Phototherapy is to help humanity across the world. Thank you so much for watching this video. See you in next video. Bye for now.